In this video, I'm going to show you why being sedentary is one of the worst things that your patients can do. I'm Dr. Joe Camarado, and I'm with Across The Continuum, and it's my goal to make you a better strength coach as a physical therapist. When it comes to physical activity, I feel like everybody on the planet knows that they need to be more physically active, just like everybody on the planet probably knows that they need to eat more vegetables, they need to sleep more, and they need to avoid smoking. Just like your patients will benefit from not smoking, you'll benefit from subscribing to our channel so you don't miss any content when it comes to physical therapy and strength coaching. Despite a lot of people knowing that they need to be more active, we see that there's a big problem when it comes to physical activity, and there's a few reasons why. One of the problems that we see with people not being active enough is that they feel fine despite not being active enough. So the difficulty is, how can we make a behavior change when somebody doesn't feel like their behavior really needs to change? The big question they might be asking is, what's the big deal? One aspect of the answer is the enormous $117 billion price tag when it comes to spending annually on conditions related to sedentary behavior. And that's just in the United States. In addition to that enormous price tag, there are multiple things that being physically active enough can help to decrease your risk of. Some of the big categories include all-cause mortality, which means dying by any means, diseases such as coronary heart disease, stroke, cancer at multiple sites or multiple types of cancer, type 2 diabetes, obesity, hypertension, and osteoporosis. It also helps to decrease risk factors for disease such as overweight or obesity, hypertension, and high blood cholesterol. Not to mention the conditions that affect cognition such as depression and anxiety, as well as Alzheimer's disease. And we also see that being sedentary increases the risk of falls as well as injuries from falls in the older population. Hashtag bone health. And finally, I'd be remiss if I left pregnant women out. Being active enough can help reduce the risk of excessive weight gain, gestational diabetes, and postpartum depression. Being physically active enough can also help to improve things like physical fitness such as aerobic capacity and muscle strength and endurance, functional capacity or the ability to engage in activities needed for daily living, as well as brain health benefits including possible improved cognitive function and improved sleep and quality of life. With a list of benefits like that and things that we can reduce the risk of, it's surprising that so many Americans still aren't hitting the physical activity guidelines by Americans. So let's go over what exactly those physical activity guidelines are. The current physical activity guidelines were put out by the Department of Health and Human Services in 2018, which is an update of their 2008 version. It has a few changes, but there are a few things that stayed the same, and not only are they the same between the Department of Health and Human Services, but if we look at organizations like the World Health Organization, they have very similar recommendations, not only for Americans, but for the entire planet. Now, there are two main categories of things that adults and older adults should be doing. Now, the physical activity guidelines do talk about babies, adolescents, as well as those who are disabled, but we're going to get into mainly the adults and older adults here because it's the most applicable for us regular physical therapists. Number one, adults and older adults should do muscle strengthening activities of moderate or greater intensity, and that involve all major muscle groups on 2 or more days a week. And then number two, adults should do at least 150 minutes, which is 2.5 hours to 300 minutes, which is 5 hours per week of moderate intensity aerobic activity, or 75 minutes, which is 1 hour and 15 minutes, to 150 minutes, which is 2.5 hours a week of vigorous intensity aerobic physical activity. Now, these two main things, the muscle strengthening 2 or more days a week with moderate intensity or greater, as well as the 75 to 150 minutes a week of aerobic activity, vigorous aerobic activity, are the mainstays when it comes to the physical activity guideline. And when we go in either direction, as far as older adults, those who have comorbidities or disabilities, and then with adolescents or younger, we see that they're just really derivations of this main recommendation. Quickly, let's go over what counts as moderate intensity and vigorous intensity aerobic activity. When we look at examples of moderate intensity aerobic activity, it's things like raking the yard, playing doubles tennis, or going for a brisk walk. When we look at vigorous intensity aerobic activity, it's things like jogging, running, as well as participating in a strenuous fitness class, so your typical steady state cardio. Now, despite all of this great information, benefits, reduced risks of things, we still see that only 1 in 4 Americans are hitting the minimums for both categories, both muscle strengthening and aerobic activity. So there's still a lot of work to be done. But the fact that only 1/3 of patients reported that their primary care physician even mentioned or educated them on physical activity is definitely part of the problem. Primary care physicians do cite a few main barriers when it comes to giving out the prescription of the silver bullet, which we know as physical activity. The first main barrier is simply time. Now, primary care physicians usually have a lot shorter sessions than physical therapists do, and their patients usually come in with 3 or more complex issues that they need to talk about. In addition to the time issue, they also say that they don't have the requisite education about physical activity in school or otherwise. And then finally, they only see people 1 to 3 times a year, and so they don't really have that kind of amount of repetition of saying these things as far as physical activity goes to really make a difference. So pivoting right from there, the final and biggest question is, as a physical therapist, how can you implement these physical activity guidelines and this new information about the dangers of sedentary behavior into your own practice? There are a few key things to keep in the front of your brain as a physical therapist when thinking about implementing physical activity guideline recommendations. Number one, if you have the opportunity, you should absolutely have people doing some sort of physical activity each and every session. We know that splitting aerobic activity into smaller chunks as short as 10 minutes is just as good for patients as doing one giant chunk of aerobic activity. So if you can have a patient come in and have them do some sort of aerobic activity for as short as 10 minutes, that's adding to the piece of the pie that is physical activity for the populace. This is one of the main differences between the 2008 and the 2018 recommendations as far as physical activity guidelines go. In the 2008 recommendations, there was a need to do at least 10 minutes of aerobic activity for it to count, and now we know that you can do substantially less and still have it accumulate. In a nutshell, if every minute counts, then we need to start counting the minutes. Number two, you have time that primary care managers don't. You're lucky as a physical therapist to see patients anywhere from 30 to 60 minutes, once, twice, 3 times a week. And so you have that quality time to not only build rapport and become an authority figure, but to mention repeatedly that physical activity is really good and make plans with your patients to do the physical activity guidelines, or at least get close to them. Not only that, but you can also build it into your plan of care to make sure that as a medical prescription, they are doing these things that have such a robust effect on their health overall. And then number three, you want to do no harm. Just like you and every physical therapist before you and every physical therapist after you, you want to do no harm and you want to do what's best for your patient. Now, I can sit here and make an argument that if you're withholding physical activity recommendations, or if you know that physical activity recommendations are going to be good for this person, then you're probably actively harming them because they're sedentary or because they're not hitting those guidelines, when they probably could be if you were spending time educating them and giving them a strength forward and aerobic forward plan of care to do. I mean, if there was something that you could put in your intervention or your plan of care that would significantly decrease the risk of them dying or increase the quality of life that they're having, why wouldn't you? Wouldn't that active plan of care or active intervention take precedent over a more passive or sedentary plan of care? In my opinion, I think they should, especially considering that passive and active treatments seem to have similar outcomes. So if a passive treatment and an active treatment are going to have similar outcomes as far as pain and disability goes, but one has a robust effect on the rest of the health of the patient, in my opinion, we should go with that one. Now, if you found this information helpful or educational, go ahead and recommend that your coworkers watch it, your physical therapy friends watch it, and make sure to comment down below and let me know what I missed or what I should talk about next time. And as always, make sure to like and subscribe so that you don't miss anything.